Does an L4, L5 disc bulge get back to normal again? Does an L5, S1 disc bulge get back to normal again? That's a great question I got asked on one of my comments, and I want to address that question right now in this video. And if you're new to my channel, be sure to click on that subscribe button and the notification bell so you get notifications on all my new videos that come out weekly, so you know how to relieve pain, conquer stress, supercharge your health naturally, safely, and effectively. Hey, there's Dr. Walter here. Just finished another day of taking care of people in our office. I'm a corrective care chiropractor in Vaughan, Ontario, Canada, and I get a lot of people coming in with a variety of different conditions, primarily spinal pain related conditions like disc bulges, sciatica, bad posture, back pains, upper back pains, neck pains, and anything associated with spinal pain. And we apply corrective methods to help people resolve their immediate pain concern and also get them function again, get them moving again, get them back to a better life. And we use corrective chiropractic methods to do that. And in this video, I want to answer a question that I got recently. Can a disc bulge get back to normal again? Specifically an L4, L5 disc bulge or an L5, S1 disc bulge. Can that get back to normal again? And first of all, let me show you here in this model. So here's a spinal model, right? So there's a vertebra above and below. This is a degenerated spinal model. And usually when there's a disc bulge, oftentimes there is spinal degeneration that's occurred. And you'll see over here, right there, is a disc bulge. And then I'll show you what it looks like from an aerial view. So take a look right there. You'll see, let's get that a little closer. Okay, right there, that's good with light. Take a look right there. You'll see that the annular fibers are actually disrupted or torn, causes the inner nucleus pulposus to leak out right there, that red coloration there. And that's how disc bulge starts, is there's damage to the annular fibers and there's a loss of disc integrity. And if you can think that the discs are actually shock absorbers, they function to absorb shock in between the vertebrae. So there's healthy disc right there. Okay, that's a healthy disc, and that's an example of what a disc bulge would look like. That would be a posterior lateral disc bulge because it's going off to the side, and if it was going back into the spinal canal, that'll be a posterior central disc bulge. And so people ask me often in my comments in my videos, because I have videos that relate to exercises with respect to disc bulge pain, and also a whole bunch of other videos related to disc bulges, and I'll post them up here in the card right there, and also in the comments below. Can a disc get back to normal again? And I really understand that question. I think it's a very valid question. I want you to remove the focus away from the disc bulge getting back to normal again and rephrasing that question to, can I get my life back to normal again? Can I function normal again? Can I move normal again? Can I get back to my activities normal again? Can I get back to my work normal again? Can I get back to doing things around the home, spending more time with family and friends and my kids back to normal again? Because I want you to really get that if you focus on the disc injury only, that is permanent disc damage and permanent disc degeneration right there. That's permanent damage. That disc bulge may not actually resorb or improve. I have seen cases where it has. I've heard of cases where it has. I've had patients in my office that have had MRIs when they came in. They've done corrective care and chiropractic adjustments and did a post MRI 6 months later, and some areas of the discs and some areas of the lower spine improved or resorbed. So I have seen that, but that is not an objective or a goal of treatment for me in my office. The goal of therapy should be to improve, first of all, decrease pain, decrease inflammation, decrease pain associated with the disc bulge injury, decrease any referral radiating pain, which is pain into the legs. Those are referral pains, which means that the problem is progressing and getting worse. And also stabilize the spine, correct the spine with chiropractic adjustments, correct posture with the overall goal of improving function, mobility, and strength and coordination of the lower back, and also restoring quality of life and quality of health. Those are the main objectives. Whether the disc bulge resorbs or gets back to normal again, that I cannot answer. That's impossible to know. And the truth is, it's very possible, it's very likely that patients will improve with their spinal condition, will improve with their spinal alignment, will actually improve with their pain condition and function normally again, for the most part function normal again and have a normal quality of life, and they may still have a disc bulge that is asymptomatic or not inflamed, but is improved because the corrective methods, or we apply corrective methods on the spine to decrease the pressure and irritation on that disc. So will it get back to normal again? Don't know, and that's not the focus of my therapy or my corrective therapies in our office. The focus of our corrective therapies is to determine what's causing the disc bulge problem. If it's a spinal alignment issue, where the alignment of the spine is off its normal alignment, that's creating abnormal loads or abnormal weight distribution on parts of the discs that could lead to disc damage and disc degeneration and disc bulge. My goal is to find that with our different assessments and to apply corrective methods and techniques to improve the spinal alignment to its normal neutral position, or as close as possible, or at the very minimum minimize it, and allowing now pressure and irritation to come off the disc and allowing proper healing to occur, reducing the pain and inflammation in that area, and therefore allowing people to experience relief of pain associated with disc bulge conditions. Just recently, in October, so we're in December now, so 2 months ago, had a patient that came in with a massive, severe, acute low back condition. Based on his clinical assessment and exam, I determined it to be an L5 disc bulge, possibly an L5 disc herniation. Now we've done a bunch of tests and X-rays as well, and I saw there was misalignment of the spine. In this case, he had his lumbar curve that was bending back too much because of an upper body translation, upper thoracic translation, and we're sending him off for an MRI for confirmation. But in the meantime, he started his corrective care protocols. He was getting adjusted 4 days a week, and when the pain began to subside, which it did, we started to do some corrective care methods in the office to improve the spinal alignment. And now we're in December, so it's approximately 8 to 10 weeks later, and his pain has significantly decreased, down by about 90%. Before, he was not walking, he was walking well, he was limping through the office, coming in from the car into the office, and now he's walking better. There's still some mild pain with walking, but at least he's walking better, walking longer, able to sit more, and leg pain has completely gone. Toe pain, leg pain, calf pain is completely gone. There's some left side of low back pain, left side of gluteal pain, but he's managing quite well. And we're applying corrective methods, and he's done really well with that. And we're still waiting on MRI for confirmation, but all things point to an L5 disc bulge. But the point is that I don't know if the disc bulge is improved. We'll see on the MRI what it shows. I don't have a before MRI to compare to. I wish I did, and then a post MRI, but we're going to get an MRI. But if the MRI shows that there's still a disc bulge present, which confirms the diagnosis, but clinically his clinical picture is improving, well, did the disc bulge get back to normal again? Well, it's obviously no, right? If it shows still a present disc bulge, but clinically his clinical picture is improving, his quality of life is improving, he's a lot happier, and also off most of the high medications and drugs like the opioids and the morphines, and just taking some things like Tylenol and Advil just to get him by through the day, but not taking the heavy drugs like the morphine. So that's an example, a case example of where someone is improving, and I see this over and over again with a lot of our patients that come in with disc problems, disc bulges, and symptoms associated with that. So the goal should not be to focus on does the disc bulge get better again, but the goal should be to focus on, am I going to get better again as a person? Is my quality of life going to get better again? Is my quality of health going to improve? Am I going to get back to normal functioning activities in my day-to-day activities? That's what the goal should be. That's what the question should be. And I can tell you with my experience, I've been a chiropractor for 20 years now, that I've seen a lot of people do really well with corrective chiropractic care for conditions, chronic conditions, and even acute conditions that relate to symptoms of disc bulges, either L4, L5 disc bulge, L5S1 disc bulge, especially after a lot of other sessions and therapies have failed them. Things like drugs, things like therapies like physiotherapy, even massage, acupuncture. Nothing inherently wrong with all those. A lot of our patients use them as co-management to chiropractic care, but a lot of these things have failed them, and they come to an office such as ours where we begin to focus on the primary problem, which is the spinal condition, and begin to fix that and begin to work with that, and we see people's condition improve and their quality of life and quality of health improve. So hope that answered your question. If you enjoyed that, please leave a comment below. If you have this bulge condition, let me know what's worked for you and let me know what hasn't worked for you. I'm really concerned and curious about that. Leave that in the comments below. And if you enjoyed this, give this video a thumbs up. And if you are on this channel and you're currently a subscriber, I thank you for being part of this community and watching these videos. And also, if you're new to this channel and new to this video, please subscribe below to get more content like this on a regular basis, on a weekly basis, so you don't miss out. Thanks again. It's Dr. Walter Salubro signing out, and I'll see you on the next video. To learn more about how Corrective Chiropractic Care at Back to Health Chiropractic Center can help you with your chronic pain problem, visit www.ibthcc.com. Back to Health Chiropractic Center is located at 20 Cranston Park Avenue, number 6, Vaughan, Ontario, L6A2W2.